Hello, this is Christian España Schmidt and this is my channel #IMPOCUS. This video is about subcutaneous edema or cobblestone appearance. Again, please subscribe and like the video so we can find a larger audience. Also, you can follow us for new videos. So this is a phase array probe. And we have the normal ultrasound of the lower abdomen or abdominal wall in a patient. In here, we can see the skin clearly. We can see the subcutaneous fat. We can see the cellular subcutaneous tissue. And then we can see muscle, fascia. So this is where edema is going to occur within the cellular subcutaneous tissue and cellular subcutaneous fat, and depending on how bad, even muscles. So this is a clearly abnormal leg of a patient, and then we can see here fat lobules that are full of fluid, and they are hyperechoic, and they are surrounded by hypoechoic areas where there is fluid. This patient had heart failure and severe anasarca. It took several days to diurese this patient. This is another example, and we can see cobblestoning in a short axis. This is the bone of the forearm of a patient who had cellulitis. You can see the skin, and you can see below that there is significant cobblestoning. The idea of this specific ultrasound was to rule out the presence of abscess or gas. Here you can see the bone and the skin, and in between you can see the cobblestoning. Cobblestoning does not appear only in hydrostatic edema, but can appear in inflammatory edema as long as there is water in the interstitium or fluid in the interstitium. It also can help us to identify other type of edema, such as myxedema, so we can rule out other disease. We can rule out the presence of abscess. This is another short axis from a shin of a patient who had crystal-induced arthritis and severe edema, and this is also cobblestoning. So cobblestoning can be associated to other inflammatory disease. Finally, this is a long axis of the left forearm of a patient with extravasation of IV fluids. The IV was malpositioned, and the IV pump continued infusing the IV fluid in the interstitium of the patient. And you can see again cobblestoning. Here, the idea was to prove that the reason for the edema was indeed the extravasation of fluid. And also we were able to prove that vessels were patent. You can use this sign every day, like proving that the patient is diuresing and the edema is being moved. Also proving that cellulitis is improving. You can also rule out the presence of gas. You can rule out the presence of abscesses. And this is the video. Thank you, and keep scanning. Remember to like if you find this video useful.